Aspirin is a common over-the-counter medication that has been used for centuries to relieve pain and inflammation. But did you know that aspirin may also have cancer-fighting properties? A study published September 14, 2022 concluded aspirin appears to have a beneficial impact on both the biological mechanisms underlying cancer and the overall survival of cancer patients. Studies have shown that cancer patients who take aspirin are about 20% more likely to survive than those who do not. Welcome back to our channel. In this video, we'll discuss the evidence for and against aspirin's cancer-fighting claims, as well as the potential risks of Reye syndrome in young humans. Aspirin is a type of non-steroidal anti-inflammatory drug or NSAID. NSAIDs work by blocking the production of prostaglandins, which are chemicals that play a role in inflammation and pain. Aspirin has been shown to have anti-cancer effects in a number of studies, both in vitro and in vivo. For example, one study found that aspirin reduced the growth of colon cancer cells in mice. Another study found that aspirin reduced the risk of death from colorectal cancer in humans. Aspirin, a widely used over-the-counter medication, has garnered attention for its potential anti-cancer properties. While more research is needed to fully understand its mechanisms and long-term effects, several studies have provided promising evidence of aspirin's ability to combat cancer. In vitro studies conducted in controlled laboratory settings have shed light on aspirin's direct effects on cancer cells. These studies have demonstrated that aspirin can, number 1, inhibit cancer cell growth. Aspirin has been shown to impede the growth and proliferation of cancer cells in various types of cancer including breast, lung, and colon cancer. Number 2, induce cancer cell death. Studies have indicated that aspirin can induce apoptosis, a programmed cell death mechanism in cancer cells leading to their elimination. Number 3, modulate cancer-related signaling pathways. Aspirin can influence signaling pathways involved in cancer development and progression, potentially contributing to its anti-cancer effects. In vivo studies conducted using animal models have further supported aspirin's anti-cancer potential. These studies have shown that aspirin can, number 1, reduce tumor growth. Aspirin has demonstrated the ability to reduce the size and growth of tumors in various animal models of cancer, including colorectal cancer and lung cancer. Number 2, enhance tumor sensitivity to chemotherapy. Studies have indicated that aspirin can increase the effectiveness of chemotherapy drugs by making cancer cells more susceptible to their effects. Number 3, improve survival rates. Aspirin has been shown to improve survival rates in animal models of cancer, suggesting its potential to prolong survival in human cancer patients. Clinical studies involving human participants have provided additional evidence of aspirin's anti-cancer effects. These studies have shown that, number 1, aspirin reduces colorectal cancer risk. Several studies have consistently demonstrated that aspirin can reduce the risk of developing colorectal cancer, one of the most common types of cancer. Number 2, aspirin lowers cancer mortality. Studies have shown that aspirin can reduce the risk of death from certain types of cancer, including colorectal cancer and lung cancer. Number 3, aspirin may improve survival in cancer patients. Some studies have indicated that aspirin can improve survival rates in patients with certain types of cancer, such as esophageal cancer and breast cancer. The precise mechanisms by which aspirin exerts its anti-cancer effects are still being investigated, but several potential mechanisms have already been identified. Number 1, anti-inflammatory effects. Aspirin's ability to reduce inflammation, a hallmark of cancer, is believed to play a role in its anti-cancer properties. Number 2, anti-platelet aggregation effects. Aspirin's ability to inhibit platelet aggregation, a process involved in blood clotting, may contribute to its cancer-preventive effects by reducing tumor angiogenesis, the formation of new blood vessels that supply tumors with oxygen and nutrients. Number 3. Modulation of cancer-related signaling pathways. Aspirin can influence signaling pathways involved in cancer development and progression, potentially leading to the suppression of cancer cell growth and proliferation. There have been several large-scale studies that have investigated the link between aspirin use and cancer risk. One study, the Women's Health Study, found that women who took aspirin regularly had a lower risk of colorectal cancer. Another study, the Physicians' Health Study, found that men who took aspirin regularly had a lower risk of colorectal cancer and prostate cancer. A large-scale clinical trial was launched on October 22, 2015 to investigate whether aspirin can effectively prevent the recurrence of cancers. This trial, funded by Cancer Research UK and the NIHR, involves approximately 11,000 participants who have been diagnosed with early-stage bowel, breast, prostate, stomach, or esophageal cancer. If the trial proves successful, it could revolutionize cancer treatment by providing a cost-effective and accessible method to reduce the risk of cancer recurrence. Scientists believe that aspirin's ability to inhibit platelet aggregation, a process involved in blood clotting, could contribute to its potential cancer-preventive effects. They will closely monitor participants for any signs of cancer recurrence. The trial, spanning up to 12 years, will take place across 100 centers in the UK, involving individuals undergoing or having undergone early-stage cancer treatment. If the trial demonstrates aspirin's effectiveness, it could significantly transform cancer treatment. Aspirin's low cost and ease of administration could make it a widely accessible and effective tool for preventing cancer and cancer recurrence, as well as improving survival rates for many patients. Alex King, a 51-year-old breast cancer survivor, expressed her support for the trial, emphasizing the importance of reducing the likelihood of cancer recurrence and alleviating patients' anxiety. The large-scale clinical trial investigating aspirin's potential to prevent cancer recurrence holds immense promise for improving cancer treatment outcomes. If successful, it could provide a simple, cost-effective, and accessible method to reduce the risk of cancer relapse and enhance patient survival rates. Reye syndrome is a rare but serious condition that can affect the brain and liver. Reye syndrome is a brain disease that can affect children and teenagers. It typically develops shortly after a child recovers from a viral infection like the flu or chicken pox. Symptoms can include vomiting, personality changes, confusion, seizures, and loss of consciousness. While liver damage is common in Reye syndrome, jaundice, yellowing of the skin and eyes usually does not occur. Sadly, Reye syndrome can be fatal, with 20 to 40% of cases resulting in death. For those who survive, about a third may experience lasting brain damage. To prevent Reye syndrome, it is important to avoid giving aspirin to children, especially during or after a viral illness. In the 1980s, when aspirin was withdrawn for use in children in the US and UK, there was a dramatic decline for more than 90% in Reye syndrome cases. Aspirin, a common over-the-counter medication, has been investigated for its potential anti-cancer properties. Several studies have shown that aspirin can reduce the risk of developing certain types of cancer, such as colorectal cancer. Aspirin's anti-inflammatory and anti-platelet aggregation effects are believed to contribute to its cancer-preventive effects. Anti-cancer properties of aspirin reduces colorectal cancer risk. Aspirin has been shown to reduce the risk of developing colorectal cancer by up to 20%. Inhibits cancer cell growth. Studies have demonstrated that aspirin can inhibit the growth of cancer cells in various types of cancer, including breast, lung, and prostate cancer. Modulates cancer-related signaling pathways. Aspirin can influence signaling pathways involved in cancer development and progression, potentially contributing to its anti-cancer effects. Despite its potential cancer-preventive benefits, it is crucial to note that aspirin can increase the risk of Reye syndrome in children. Reye syndrome is a rare but serious liver and brain disorder that primarily affects children and adolescents. It is often associated with aspirin use, particularly during or after viral infections. In conclusion, while aspirin has shown promise in reducing cancer risk, it is essential to exercise caution and seek medical advice before using it, especially for children. By understanding the potential benefits and risk of aspirin, individuals can make informed decisions regarding its use. We hope you found this information helpful and informative. If you did, please like this video, subscribe to our channel, and leave us a comment below with your thoughts on aspirin and its potential role in cancer prevention. We would love to hear from you. Until next time, keep learning and stay healthy.